how is your approach different for non-operative ACL tears versus operative ACL tears?
The first phase, we want to reduce the swelling, regardless if it's non-op or operative,
Mhm.
and then we're going to regain the strength. And you're going to check for the deficits as well: quad, hamstring, glute strength before or after surgery.
Mhm.
And then, depending on what they want to do, they might not need to get the surgery. Like
Okay.
you said, like the younger athletes that have their whole life ahead of them, they still want to play sports. They're
Yeah.
probably going to have to get the surgical intervention. Just as an example,
Mhm.
last year I had a woman in her 60s tear her ACL skiing. The doctor did not want to do surgery. She had goals of hiking and skiing. Rehabbed her for 4, 6 months. And I just got an email last week that she went back to the same mountain that she tore her ACL, and she was able to ski. Maybe
Awesome.
not as aggressively as she once did. Without surgery, she was able to get back on the
Back in a couple of months.
slopes.
Yeah,
Yeah.
4 months or so. Usually, everybody always asks the time frame. The decision whether to do surgery or not really needs to be individualized. I'm a firm believer of that. Now, I'm biased. I'm not a surgeon, but this is one of those things that I have absolutely no problem sending to a surgeon for, because if you don't do the surgery, there are risks and benefits. If you do the surgery, there are risks and benefits. One of the big questions is timing of things. If I don't do the surgery, how long will it take for me to get back to skiing? Maybe not as aggressively as you said, but usually it's like 4 months or so. And I'm just throwing that number out there because it makes sense. As opposed to if you do the surgery, it's going to take longer for that graft to adhere to where you're putting it in. And that might be a more prolonged recovery, usually anywhere between 6 and 12 months. I usually say 9 months to kind of split the difference. When counseling patients about, whether or not an operation is indicated, talk about realistic expectations and, what happens if you don't do the surgery versus what happens if you do the surgery.